That's good. Okay, ready?
Yeah. Money is at the forefront of operations for pharmaceutical companies. The CDC and the FDA must partner with large corporations to provide drugs for American citizens. However, the relationship between these partners is not always a morally stringent one. I have to go back. If you start at I'll start over. Money is at the forefront of operations for pharmaceutical companies. The CDC and the FDA must partner with large corporations to provide drugs for American citizens. However, the relationship between these partners is not always a morally stringent one. History has shown us that when billion-dollar industry combines with government regulation, the consequences are severe, far-reaching, and heavily scrutinized. That is, if the public is willing to call out corruption and demand a systematic change. In the case of childhood vaccines and federal law, the conflicts of interest from this partnership would negate the effectiveness of the regulation because the common people would feel deceived and coerced into vaccination practices. Devious activity in the medical community keeps parents rightfully skeptical about vaccines, even after the thimerosal autism link has been invalidated. In an ideal world, doctors and drug manufacturers would collaborate with politicians, and each party would have the best of intentions. We all know this is not how people make decisions in capitalistic society. Conflicts of interest spring up between parties working intersectionally and often are driven by a desire for personal gain. According to an article published by the NIH in 2012, the motivations for bias in vaccine safety research range from reasons political, financial, legal, and bureaucratic. Such biases affect vaccine manufacturers at the top of the chain, medical journals publishing research results, and health officials working in hospitals across the country. When the obstruction or avoidance of vaccine risk factors is thus delivered between each of these fields, patients feel underinformed about the potential harms of vaccination. The commonality of these occurrences is a major hindrance to the public's genuine trust in the health sector, especially regarding vaccines. Government involvement would only exacerbate such issues. Julie Gerberding, president of Merck Vaccines, one of the largest vaccine producers in the country, was director of the CDC from 2002 to 2009. Merck currently supplies more than $4 billion annually in vaccines to the CDC, and this amount is soon to increase. Gerberding's previous influence in the offices of the CDC plays a conflicting role with her new position as president of the manufacturing giant. There are also instances of ineffective vaccines being released, marketed, and administered to patients, in some cases producing severe side effects. In 1998, a vaccine called RotaShield, developed to fight rotavirus, was approved as safe by the FDA. Less than a year later, 102 children suffered from a condition known as intussusception or severe bowel obstruction, and the vaccine was removed from the market. 29 of the infected children underwent surgery, and one infant died from the condition. RotaShield was subsequently removed from doctors' offices, but it begs the question, why was it approved safe in the first place? The costs of vaccination have been skyrocketing lately, as fully detailed by a New York Times article from last July entitled "The Price of Prevention." According to the CDC, the price tag of full vaccination for a child between birth and 18 years of age, covered by private insurance, has risen from $100 in 1986 to $2,192 in 2014. Insurance premiums adjust accordingly with increasing immunization costs. Health insurance is simply a guise for steadily growing medical expenses, some of which are entirely unaffordable for our nation's poorest. Parents are not the only ones who experience the pains of rising costs. Doctors often lose money with every vaccine they administer. Many primary care physicians have stopped administering vaccination altogether, or they simply reserve whatever shots they do have for long-standing patients. A 2008 study conducted by the American Academy of Family Physicians surveyed 2,000 of its members and found that 44% reported referring children and their parents to alternative immunization locations, such as the public health department, due to a lack of adequate payment. The survey also found that 50% of respondents were not participants in the VFC program, which provides vaccines to uninsured children. These reservations from doctors lead to stressful situations for parents. One mother in San Antonio, Texas, was forced to call 10 pediatricians before finding someone to vaccinate her son because her usual doctor did not offer the service, the local pharmacies only immunized adults, and the city health clinic would not accept her insurance. Circumstances such as these are bound to deter parents away from routine visits to the doctor, vaccine-related or not. Because pharmaceutical companies are profit-driven, the cost of vaccines will continue to rise and doctors will become less likely to invest in their distribution. This type of financial and logistical hassle is an outrage and would only be complicated further by strict legislature.
Ding, ding, ding.
Bow!
Money.
I don't even know how many hours